On Thursdays around this time, we have a feature we like to call What's Up, Doc? We spend some time with the experts at Mercy Health. We learn lots of important things. They learn that, well, maybe I shouldn't say yes to being on radio shows. Everybody walks away having learned something from these get-togethers.
They do learn that.
And this morning, we're going to learn a whole bunch of things, especially about heart disease and women. Now, this particular name, I'm just going to go right. Open, honesty, and transparency is what we're all about. We have I'm having a little difficulty in name pronunciation. I'm going to do my best here, and we'll see if the doctor gives me a thumbs up or a thumbs down. Okay?
Okay.
Our guest this morning is Dr. Shobashalini Chokkalingam.
2 thumbs up.
Really?
Ooh.
Nice. Thank you. I pondered. I pored over it. I did it phonetically. I wanted to have it right. I didn't want to have you angry right off the bat and think that I was a complete idiot. I thought that would come later in the interview.
Doctor, he hasn't slept in like 3 days worrying about this
right.
moment right
I've just
now.
been drinking a lot of coffee and trying to get this right.
Good morning to both of you gentlemen. That was really fun, and you were really spot on. And congratulations. Just only 24 letters in the alphabet there, and you said it just too good.
I'm feeling pretty good about myself. I don't mind saying so.
All your hard work paid off, Rafi.
Tell us a little bit about yourself, Doctor.
Yes, good morning, and thanks for having me on the show. It's starting off with the heat wave, kind of quote-unquote, we're having after the really frigid weather.
Yeah.
And, well, I'm a cardiologist with Mercy Health in town in Rockford, and I joined Mercy Health in November this past 2020. And, it's a wonderful team that I'm very glad to be associated with and working for Mercy Health. And I'm a board-certified cardiologist, and my interests include all aspects of cardiology, of course, but with focus on women's heart health, preventing heart disease, valve dysfunction, valve problems in the heart, just making sure the community I serve has a much better heart health. So that's in a nutshell about me.
What drew you into this particular field in medicine?
Oh, I get asked that quite a bit, but I was all of 13 years of age when I decided I'll be a heart doctor. Because home visits, my grandmom had congestive heart failure, and I was so thrilled to see her improve so much when she got Lasix, the water tool. So, she was all humming and serving breakfast when she couldn't breathe just about 24 hours prior. So
that would be enough. That would be enough to get your attention. Go, wow, look at the good I can do going forward in life and have other families feel the same way that I'm feeling.
Yes, exactly. That's a great way to impact. And I think as cardiologists, we love that instant gratification. That's the best gift for me, to see my patients doing much better and enjoying their life and having a great quality of life.
Doctor, this is something we ask all our guests here on What's Up, Doc, and just to further know about your background, where'd you do your schooling? Here in the States?
In Madras Medical College in hot southern India. And then I came over here for my residency in internal medicine at Henry Ford Hospital in Detroit, the Motown. And for a cardiovascular fellowship, I went to sunny Southern California, Loma Linda University.
Did your college in India, did they win any national titles in football or anything like that?
If they did, I wasn't watching. I was a complete nerd.
Well, let's talk a little bit about your specialty here. Heart disease in women. I'm looking at a stat that says heart disease is the leading cause of death for women in the United States.
It sure is. It sure is. It is the leading cause. To put it in perspective, 1 in 3 women die of heart disease and stroke every, all time. And to put it in perspective, 1 in 31 die of breast cancer. So every 80 seconds, we lose a woman to heart disease. That's 1 too many, right? And that's why February is the Go Red month, to increase that awareness, because media attention, traditionally, men have been, showcased in advertisements, media, and so the impact is more. So women think, oh, maybe I'm not a candidate for that. Maybe I'm not at risk, but increasing risk for heart disease in women. Yes.
Nature versus nurture, big debate always. Where do you lie with heart disease in women? Is that a huge genetic problem? You just born with it, or lifestyle choices are a big factor? Which weighs more in your mind?
It's actually a mix, but let me tell you, the topmost is 80% of heart disease is preventable. And to me, that is the big take-home message. Yes, I mean, it's like an enemy that you know you can deal with if you did the right things. I mean, isn't that wonderful? At least you know what to do when 80% is preventable. And environmental factors, our lifestyle habits. Yes, genetics, you always carry the good and bad of genetics that we inherit. But a lot is our lifestyle factors like smoking or, unhealthy food or not exercising or having that high blood pressure or having your sugars too high. So those are all the risk factor monsters, I call them. And so know about your heart, know about your risk for heart. And those are the major factors affecting heart health. So know about them. And it's 80% preventable. I think that's a fantastic number.
That is. Let's contrast men and women here a little bit as far as heart disease symptoms go. Do they manifest themselves differently in different genders?
I'm so glad you asked that, Riley, because it is different. And I want to start off with the symptom part saying 40%, a full 40% of heart attacks in women don't present with chest pain. So that is important for women to be aware of. It could be shortness of breath. It could be lightheadedness. It could be nausea. It could be just indigestion that normally, people do present with. Or it could be lower chest discomfort or upper abdominal discomfort. And I also want to bring attention to this I hear, like extreme fatigue, feeling wiped out. So all of these are manifestations of, they do present differently. It could also be jaw pain, neck pain, or upper back pain. So these are all the areas you want to kind of think about this right away.
If someone at home is concerned about their heart health, maybe hasn't had it checked out yet, and they want to know if their heart is up to speed, when they go to their doctor, what should they be asking for to be done? What kind of tests should be done to check up on the heart?
Sure. First of all, I want this medium, a platform to be used to make people aware that they qualify for a wellness visit, with a primary care physician, first of all. And then, talk about how they can modify their heart health risk factors. So first of all, starting with the blood pressure. Know your blood pressure, know your blood sugar level, know your cholesterol level, know your weight. And please, it's a very earnest appeal. If you are smoking, any woman smoking, please stop it. Only for your sake. It's not about anything else, but just for your own sake. Any woman who smokes even 1.4 cigarettes a day triples the risk of stroke and 4 times the risk of heart problems. So maintaining that good normal blood pressure, 120/80, that's one goal. That will reduce your risk of heart disease big time. Maintaining that blood sugar less than 100, fasting. So making sure you're eating the right heart-healthy diet, low in carbohydrates, low in fried food, low in red meat. They all go towards building up the positive, effect.
That's all the good food, though, doctor.
Well, I'll tell you, there's a lot. I'm completely vegetarian, vegan for about 20 years now. And, I'm a foodie, everybody. I'm a foodie, but I love the right, healthy food. And I think it's the trendy in thing, I want to say.
Yeah, I can see that. But you can still be trendy and in and eat healthy at the same time.
Exactly. It really, all the upwardly, the cool people, the aware people, the ones who want to take care of their life. They want to take control of their life. And for the sake of themselves and family, they're all eating right. And that's the real cool thing around these days.
One more question about who and how to get tested. Is there a lower bound to the age when you should start really focusing on your heart health?
Yes, I will also about the testing, I think I hope I want to make clear that cholesterol testing is probably the single most important thing you can do as a lab test. Find out where your cholesterol is. Now, the lower age, for example, no age is really low enough for because there are very many kinds of heart disease. It could be a congenital heart problem, like somebody detected a murmur. So for that, age is really not a limit. You could be as young as 4, 3, 2, newborns have heart problems. Women, I'm saying, girl child, as well as high cholesterol. There's a familial hypercholesterolemia where the recommendations are to test children as young as 9 to 11. And again, between 14 and 16 years of age, children of those who have familial hypercholesterolemia. That way, we can start treatment very young to lower their cholesterol so that they don't get into a heart attack problem in their 30s or, early 40s.
Well, in listening to you this morning, for anybody who's gone along with that myth forever that heart disease is for men and cancer is the real threat for women and heart disease is for old people, well, you've shot all of those out of the sky.
Well, I hope we do that. It's all about raising awareness. I want to make a mention, African American women, Hispanic women. I mean, their awareness is less, and also they have, African American women, unfortunately, have a higher risk of being very sensitive to the sodium they take. They have a gene that makes it just so much more sensitive. And so for them, definitely, spending time describing this, discussing this, and lowering their salt intake to 2,000 milligram or less, that plays a huge role in that subgroup population to reduce their heart risk. And Hispanic women are very nurturing, really, as you might have found out already. They take care of everybody else but themselves. And it's been now shown that women call 911 much more faster, earlier for others in the family than for themselves. And that has got to change. And I also appeal to all family members, please look out for the women in your family, because it's the need of time. The incidence of heart disease in women is much more. It's climbing because of many risk factors and because we're only now finding what those are and trying to create awareness and treating them.
Hey, doctor, I think we'd be kicked out of media if we talked to a doctor these days and didn't bring up coronavirus at least once. I know there's been some thoughts that COVID-19 has long-lasting effects on the heart. You're a heart doctor. What do you think about that?
We definitely, certainly, because there are also microthrombi, like little clots in little blood vessels in the body. And heart is no exception. And we were just a guest during the very peak COVID days, how the heart was being affected, be it muscle damage, be it heart muscle damage, be it a full-blown weakness of the heart muscle. We saw a lot of congestive heart failure related to the virus. Viral attacks do lead that, but we've seen patients presenting with completely different symptoms, and then we found after COVID and finding out that their heart function now is really low. So people can have chest pains. I'm seeing chest discomfort, recurrent later on after COVID subsides. Also blood clots in the lung arteries. That can happen, after COVID. But just a straight weakening of the heart muscle certainly is happening after COVID. So any symptoms, people who had COVID for which they did not need to be hospitalized, if you have chest pain, chest discomfort, or a feeling your heart is racing, please seek medical attention right away. Call your primary care heart doctor to make sure your heart is in good shape.
Speaking of getting in touch with medical care right away, for people who have been listening to you this morning and have been inspired, I don't know why they wouldn't be, how is it they get in touch with you?
For sure. If you call 815-971-0600, that's a way to make an appointment with me. And, Mercy Health Heart and Vascular Center, so they can call and make an appointment, for sure.
She is Dr. Shobashalini Chokkalingam. I think I got it twice. I think I may have gotten it twice here.
You deserve all the first prize, the award now today, Riley. That was awesome.
Joe, I think I'm just going to leave now. My day here is complete.
I got the rest of the show. It's fine.
Doctor, thank you so much for the good humor, the great information, and for hanging out with us this morning. We really appreciate it.
Thank you very much, and thanks for having me over at your show.
It was a pleasure, an absolute pleasure.